Welcome back. I brought Sharon back with us because really what we want to do is respond to what this mother has been through, a time of diagnosis and then loss of diagnosis and 2 years that almost cost her marriage. And so I know you're working on helping physicians and practitioners around the area of early diagnosis. Tell us about what you're doing and how you feel about that story.
Yeah, well, unfortunately, it's not a rare occurrence. It's not unusual to hear a story like Lorena's. Not only like clinically have I met lots of families that have had some similar experiences where their children, aren't getting the diagnosis early on, that they've been concerned for a long time, and so there's this delay and gap in accessing services. But unfortunately, the research across the U.S. kind of bears out the same story. I mean, kids today aren't really diagnosed with autism until they're about 3 to 4 years of age, with parents actually noticing their first concerns between 12 to 18 months of age. So there's a huge gap between the time that parents are saying there is something going on and the time that they actually get that diagnosis. So, there's a few key messages, I think, from her story. One is we should be listening to parents. I think that's one of the biggest things, is that it's really important to listen to parents when they're coming in and saying, there's something going on with my child. Oftentimes they're not able to really pinpoint what's going on, especially when we're talking about our little ones, so the 12 to 18 month of ages. But usually there's something to it, so we really should be listening to parents. I think the second thing is that, as Lorena said, she did go to her pediatrician. And when parents are concerned about their child, especially infants and toddlers, it tends to be the pediatrician who is the first point of contact. So I think the message for pediatricians and healthcare providers is that we should be doing early screening. And in fact, there are parameters out there that were put out by the American Academy of Pediatrics saying that doctors should be doing the screening. But I don't know if that message has really been translated too much into real-world practice. I think we're still seeing a lot of pediatricians, unfortunately, who aren't using well-validated screening tools like the PEDS that you mentioned. And families are specifically concerned about autism. There's also something called the Modified Checklist for Autism in Toddlers, the MCHAT. So there are very quick, short screening tools that are available to pediatricians that they can use in the office setting. But on top of that, there are other resources. So it doesn't have to fall solely on healthcare providers and pediatricians and other doctors, but there are community resources. And I think that, unfortunately, even though they're out there, not a lot of parents know about them. And I think that's one of the reasons I wanted to come on today too, is and let families know about those resources. So one is First Step. We have funding at UCSB to provide those free screenings for families in Santa Barbara County, to provide those free developmental screenings for children up to age 5, and to provide that short-term family support, which includes facilitated referral to other agencies. But throughout the 3 counties, so Ventura, Santa Barbara, and San Luis Obispo, there's also Tri-Counties Regional Center. As I mentioned earlier, one being the resource being the Early Start program, and I would say for families in Ventura County, if you're concerned about your child between ages of 0 to 3, give Early Start a call, because they can help families kind of figure out what's going on. Is it a language delay, or are we looking at something like autism? Because we also know that if we can get kids in earlier, they tend to do better in the long run. So we really want to try to catch this as early as possible. But even for children over the age of 3, there's still plenty of resources. They can call the regional center and also access evaluation services. And there's also the local school districts who can provide special education services. But on top of that, there's lots of family resource centers who are out there who can talk to parents. So if they aren't quite sure, they can talk to other parents who have gone through some of the same experiences, like Lorena. We have the Ventura County Autism Society. There's an Autism Society of Santa Barbara chapter. There's the Rainbow Resource Center, which is also run by families and parents of children with disabilities. So there's lots of places that parents can go, and lots of places to call, to email, to just talk or get more information. But again, I think the key is that parents, you should be listened to, and I think for parents that they should follow through and if they're concerned, seek out the services, because you may get someone telling you no or don't worry about it, but if you're concerned, keep pushing. Keep searching for the right place, because I think that's what Lorena did. She kept thinking to herself, there is still something going on. I know there's something going on. And because she moved forward and kept pushing for it, was able to find First Step and then get access to services through the regional center. Yeah,
here in Ventura County, the First 5 has funded the Neighborhoods for Learning. And those are really regionally located, and we'll have lots of information about how to get to those as well. We have the availability of screening there, but we really want to get children into medical homes, because it is that linear follow-up. So even if they're screened they still need somewhere to really coordinate services, somewhere that speaks their language. And some of that's our problem too, is we practitioners who don't speak the native language of whoever's coming in may not get across that concern, that the emotional part may not work. I may be able to do nausea and vomiting and diarrhea in Spanish, but in terms of a mother's concern about how her child is speaking or moving, may not quite come across. The other, with the MChat, it is a little tough sometimes because the parents don't understand the questions on there, and there are extended versions of the MChat that really ask the question in a couple different ways, so that it's not just is there a motor running inside your child or whatever, that they can really bring out what's a real answer, because sometimes some of those tests seem to turn out positive a little more frequently. In terms of what we're trying to do here, we have online the ages and stages for parents to take it home before they bring into the pediatrician's office, and not that many people tend to do it. I know we're experimenting with a computer-based version, but can you tell us a little bit about this computer-based and what you might think be the advantages or the disadvantages?
Yes. And I think that's another important thing, is that we are trying to work very closely with pediatricians, because I think the point of the matter is that, parents again are going to be mostly going to doctors when they're concerned. But we've been working on a project looking at Chattis, which is an online system that actually puts together a whole grouping of screening tools. So depending on the child's age, parents would easily be able to access those screening tools, fill them out at their own leisure at home, or possibly at a kiosk in a doctor's office, so that it gives the doctors a printout of all these different tools, kind of what the outcomes of these tools are, and gives them a starting point to talk to families. So even if families aren't able to express some of those concerns, hopefully if it's kind of triggered by the questions on these screening tools, that could be a starting point for doctors to ask some more information. What's nice about this system is that it kind of really organizes the information. Again, it gives families easy access because they can access it online. It gives us a nice little printout that doctors can use, can review, and then that gets put in the child's chart, which then again also leads to easier ways to refer the child. So it's a nice, clean system that we can actually track over time, and hopefully encourage not just families, but also the healthcare provider to say, okay, we do need to be looking at this at these various ages, and to not really discount, what some of the parents are saying.
I think the other thing we have here is the UCLA-affiliated family medicine residency, and when we train those young family medicine doctors, they really spread out across the United States, carrying the torch of early developmental screening.
Absolutely.
And I think we're seeing some video associated with this program, and that's the kind of training video that those doctors really need to see. They may not see that many children at different ages with autism. Once you've been through that early experience, it's very striking.
Right.
So Ventura, we want to make certain that your children end up in medical homes, that your pediatricians and family practitioners and nurse practitioners and public health nurses, that we're using validated screening tools. But the main thing is listening to parents, to making absolutely certain that you are listening to their concerns about speech, about how children move and how they interact with parents, how they think about problem solving, and to make certain we're using validated tools. So Ventura, I want you to make certain that you're out there, and the pediatricians and family practitioners, you're paying attention. We'll provide you with access to all these tools, and we'll see further training as these shows go on. So Ventura, it's time for you to get moving.